Right to participate. Joint Health and Safety Committees. Introduction. Before taking this module, you should be familiar with the Internal Responsibility System, IRS. Once it is understood that everyone in the workplace is personally and directly responsible for health and safety as part of his or her job, then the role of the Joint Health and Safety Committee should become clear. You should also have taken the first Right to Participate module, in which the manner in which the committee members are selected was covered. Committees and worker representatives. It is important to distinguish between the role of the committee as a whole and the role of its individual members. Throughout the OHSA, the worker representatives on the committee have different duties and functions than the committee as a whole. The worker representatives have more specific duties and functions than the management representatives on the committee. For convenience in this module, our terminology will be worker rep, means an individual worker representative on the committee, whether a certified member or not. Management rep, means an individual management representative on the committee, whether a certified member or not. Committee, means the Joint Health and Safety Committee as a whole. Committee members, means both worker reps and management reps. Employer, will usually mean the employer or the constructor, although few construction projects have committees. Health and Safety Reps, Section 8, and Worker Reps, Section 9. Throughout the OHSA, there will be references to the Health and Safety Representative. These 4 words describe the single individual, under Section 8, who represents workers in workplaces where there is no committee. This is never the worker rep on the committee, Section 9. Do not treat Health and Safety Representative and the worker rep as being the same person. We have taken the phrase Health and Safety Representative out of most sections of the OHSA quoted in this module for the sake of clarity. Be careful when reading the OHSA itself. Direct and indirect responsibility. Neither the worker rep nor the committee is directly responsible for OHS. No one should be counting on the worker rep or the committee to fulfill his or her own OHS responsibilities. Under the IRS, the employer and everyone as an individual are the direct contributors to OHS. The worker rep and the committee are indirectly responsible. The worker rep and the committee assist, consult, check, audit, advise, watch, mediate, liaise, and many other words. The 3 worker rights, including the right to participate, are part of the IRS. They are not the main part. The IRS is a system, and all systems need feedback and fail-safe mechanisms to keep operating. It is impossible for the main part of the IRS to work perfectly on its own. The role of the worker rep and the committee, overall, is to keep the IRS on track. Without the main part of the IRS working, the employer and everyone as an individual, a worker rep or a committee could have an impossible task doing OHS alone. No single person or small group of people can replace the power of everyone doing OHS all the time. The worker rep and the committee have a critical role to play in OHS, but it is not the role some people think. There is a tendency for some people to think that they've transferred their OHS duties to the worker rep or the committee. They think the worker rep or the committee is their agent, and now they can relax and not think about OHS. Some employers may think they only have to keep the committee happy and not be concerned with the potential contributions of individuals throughout the organization.